Dear students and YouTubers, greetings to all of you for the coming new year. So, today I will be talking in brief about a condition known as pleural effusion. The details will be present or will be seen in my video in Class Plus app, which you can download from Google Play Store by downloading my app Dr.Ashok Rana, and where you will get the contact of my Class Plus app, and you can purchase that course, and from that you can get all other important videos or respiratory system, cardiovascular system, nervous system, diabetes, etc. So, talking briefly about pleural effusion, I am Dr. Ashok Rana from Yamunanagar, a medical teacher to dental students for the last 13-14 years. So, coming to the topic, pleural effusion, it is the collection of fluid in the pleural cavity. So, pleural cavity is the cavity formed by two layers of pleura, that is parietal and visceral. So, if you draw a diagram, so this is outer one is parietal, inner one is visceral. So the cavity between these two layers is known as pleural cavity, and normally it has about 10 ml of clear fluid. When there occurs collection of fluid more than 10 ml in the cavity, the condition is termed as pleural effusion. This pleural effusion fluid is of two types, transudate and exudate. Transudate is clear fluid, exudate is turbid fluid, and transudate is having proteins less than 2.5 gram per deciliter, whereas exudate has more than 2.5 gram per deciliter. Then microscopic, only 0 to 5 mononuclear cells are seen in patients of transudate, whereas in exudative patients the cells will be of different types like pus cells, lymphocytes, malignant cells, AFBs, gram staining bacteria, etc. etc. So now etiology of pleural effusion depending upon the causative factor. Now if the pleural effusion is due to transudative fluid, the etiologies will be the following, that is, number 1 is congestive heart failure, number 2 hypoproteinemia, number 3 portal hypertension, number 4 you can say nephrotic syndrome, etc. These are systemic disorders which cause transudative pleural effusion. Exudative pleural effusion is caused by different conditions like bacterial pneumonia, tuberculosis, then collagen disorders like rheumatoid arthritis, SLE, then disorders of adjacent structures like lobar pneumonia, amoebic liver abscess, pancreatitis, neoplasms, etc. Then certain uncommon conditions also cause pleural effusion. The uncommon conditions like sarcoidosis, uremia, certain drugs like nitrofurantoin, etc., and post-irradiation given to patients who are having malignancy. So all these conditions may lead to pleural effusion. So clinical features will depend upon the site of pleural effusion. That means on the lower side, if it is a localized pleural effusion, or it is a massive pleural effusion on the same side, or bilateral pleural effusion. So clinical features will be pain chest, then dry cough, fever, and breathlessness or dyspnea. This will be the usual presentation by the patient who has developed pleural effusion. Then patients on physical examination will reveal there is poor movement or absent movement of chest on the site of the disease. Then there will be tenderness on the diseased side of the chest because of the presence of pleuritis, and there may be some abnormal sounds felt on the palpation of the chest. Then on percussion of the chest there will be stony dull percussion note, and then on auscultation the breath sounds will be absent on the side of lesion, that means airway entry is not there, whereas the opposite side, normal side, will show normal breath sounds. There may be association of wheeze, that is rhonchi, capitations, pleural rub, according to the stage of the disease with which the patient presented to us. Then how to investigate the patient suspected of pleural effusion? We have to do number 1, X-ray chest, that will give the clue to the diagnosis. In X-ray chest there will be obliteration of the costophrenic angle. So this is costophrenic angle. Costo means costal, phrenic means diaphragm. This angle is known as costophrenic angle. This angle will be obliterated or it will be having homogeneous opacity, whereas rest of the lung will have radiolucency showing the bronchovascular markings of the lungs. Then the second investigation is ultrasound of the upper part of the abdomen to find out movements of the diaphragm, collection of fluid on the side, and the amount of fluid which can be estimated on ultrasound examination, and we can also get the site of aspiration from where we can take out the fluid or aspirate the fluid for diagnostic purposes. Then third investigation is diagnostic aspiration and testing of the fluid which has been drawn by aspiration, and for finding out whether it is transudate or exudate, and what are the various other microscopic tests which are required for doing the tests in exudative fluid, like AFB stain, gram staining, culture, etc. And in patients suspected of malignancy, we can look for malignant cells in the diagnostic aspirate, as well as we can go in for HRCT of thorax for finding of the exact location of the neoplasm, as well as its spread in the lung, and staging of the disease can be done on HRCT thorax. Then coming to the treatment is the treatment of the cause. If it is transudate, the treatment of congestive heart failure, portal hypertension, nephrotic syndrome, etc. And for exudative fluid, the treatment of the disease like bacterial pneumonia, AFB, hypothyroidism, and then cancer according to the staging of the disease. Prognosis is good for certain conditions like nephrotic syndrome, hypoproteinemia, etc. Whereas for patients of congestive heart failure, those who develop this pleural effusion, that is bilateral, it means that the condition has already in advanced stage. Then for malignant cases, the prognosis will depend upon the staging of the disease, whether the malignancy is of third stage, second stage, etc. But because when the patient comes with pleural effusion of malignant origin, it means or usually that it is stage 4 disease. So this is the prognosis that the patient may get after getting the pleural effusion and its treatment. So this is how we can diagnose pleural effusion and treat the patient. So before concluding the topic of pleural effusion, I will request you to go to Google Play Store and download my app Dr.Ashok Rana, and accordingly you can choose your course for the studies. Thank you.